Hello, I'm Devon Herrick, health economist and senior fellow at the National Center for Policy Analysis. Our first question comes from Debbie in Baltimore, Maryland. She asks, since Obamacare, more and more people are going without insurance because they can't afford it, or they don't qualify for subsidies. What are low-income and disabled citizens supposed to do? Well, Obamacare was supposed to solve the problem of people who were uninsured. But the law made the problem worse for many Americans who cannot afford the costly health plans. In addition, many of the people forced to buy insurance cannot afford to see a doctor. Those newly enrolled in Medicaid also have problems finding doctors willing to treat them. Our proposal is to give everyone the same subsidy or tax credit, regardless of where they get their insurance, whether it's through work or through an exchange or just by calling up their insurance agent. We also believe the government should allow more flexibility in insurance and allow people to buy the coverage that best meets their needs. Our second question is from Richard in Manhattan. He wants to know, how much would Medicaid save if non-essential medicine and treatments were no longer allowed, such as elective bariatric surgery or plastic surgery? Well, first off, services like bariatric surgery and plastic surgery are rarely paid for by Medicaid. There really isn't a medical designation known as non-essential or medically unnecessary care. Services that are necessary in one patient may be a waste of money in another, but there are many medical services that could be paid for more efficiently. Research has shown that when given appropriate incentives, patients and providers could reduce medical spending by nearly 30%. Our last question of the day comes from David in Clewiston, Florida, who writes, what can we do to convince doctors to accept us as cash patients at a no insurance paperwork price? David, that's a great question. Unfortunately, there are many doctors who are hesitant to quote cash prices. Doctors who've come to rely on insurance cannot imagine that there is a significant market of patients willing to pay cash if only they were offered a realistic cash price. Ask your doctor if he or she is willing to provide a discounted price similar to what insurers pay them, if you are willing to pay cash at the time of service. If not, call around and look for doctors who will. Services like MediBid also connect doctors willing to accept cash with cash-paying patients. I would like to thank all of you for your Ask the NCPA questions. You can find us on Facebook and Twitter at NCPA. Thank you very much for your support.